Heart failure is a significant public health priority. This is the end result of all the insults on the heart muscles, including coronary artery disease, valvular heart disease, and we have a huge number of patients in the community with heart failure. This new technology, it's a sensor that we place in the heart to monitor pressures within the heart muscle so that we can treat patient optimally for heart failure. The sensor is remotely connected to the computers in the hospital, and the heart pressures are transmitted through a cloud-based system where the clinical research nurses can look at that pressure and advise accordingly. Normally, patients who have advanced heart failure, their cardiac pressures rise before they get short of breath. So we have about 3 to 4 days before patient feels breathlessness. By recording these pressures or monitoring these pressures, we can make interventions and make changes to their medication and reduce their pressures. That means that they will not get short of breath or symptomatic, and we avoid a hospitalization. One of the biggest problems with heart failure is that patients have very frequent hospitalizations. We see about 4 to 5 times patients coming in per year with heart failure symptoms and decompensation. That requires high dependency unit beds, intravenous medications, some airway support, and usually leads to 7 to 10 days admission for each patient. By monitoring these patients remotely, you can avoid those hospitalizations. To date, we have participated in 3 clinical trials. We have treated 37 patients in these 3 clinical trials. Patients are located all over the west of Ireland, in the northwest of Ireland, from Sligo down to Mayo to Galway. One of the key things of this therapy is that patient is using a handheld device which they put on their chest, and that transmits the pressure to the hospitals here. Therefore, patient gets very involved in their care, and that's an example of patient engagement, patient empowerment, and in fact patient is a part of the heart failure treatment team. Patient's engagement leads to monitoring their weight, their blood pressure, their oxygen saturations as well. Therefore, overall collectively leads to better quality of life and less hospitalization. If you have a baseline of patients' heart rate, their oxygen saturation, their body weight, their blood pressure, and their pulmonary artery pressure, and when you compare it over time, you can see whether they're progressively getting worse, or they're getting better, or they're maintaining their volume status. And that's what keeps them well in the community. We did an internal audit, and we were very pleasantly surprised to see that there was a 97% reduction in hospitalization within Galway hospitals from heart failure.
Since the implant, I'm very pleased with my life. Cordella wakes me at 8 o'clock every morning to do my readings. For 5 minutes, it saves me driving 50 kilometers 3 or 4 times a month. And I'm very grateful for Dr. Sharif and his staff for what they've done for me.
I can see this technology working well in improving patients' quality of life, keeping them well in their own homes, and with time, this can be a game changer for the treatment and monitoring of heart failure.